Families, friends, advocates, and health professionals have gathered here in downtown Washington, D.C. for a common cause to raise awareness and show support for the health and survival of mothers and infants. Launched more than 50 years ago by U.S. nonprofit organization March of Dimes, the annual March for Babies has become a symbol of hope and action in communities across the United States.
We are here because Zeta has a long-standing relationship with the March of Dimes. So we believe that marching helps to save babies' lives. We've done this for a long, long time. We raise money all over the country, all over the world for this purpose. And so we come out in numbers to show our support. We know that with just a little bit of preventative care, babies can live and can thrive.
The World Health Organization says each year more than 300,000 women die due to complications of pregnancy and childbirth, and 2.5 million babies die during the first month of life. Data from the U.S. Centers for Disease Control and Prevention reveals that the U.S. is the country with the highest rate of maternal death of any high-income nation, and there are significant racial and ethnic disparities.
1 in 10 babies is born prematurely. Black babies are 2 times more likely not to make their first birthday. So we have a lot to do. Maternal death in this country is higher for Black and brown moms. So you're talking about 2.4 times more likely.
March for Babies has garnered support from local businesses and corporate sponsors such as ASRC Federal.
One of the things that we love about the March of Dimes is the focus on maternal equity and health equity, and looking at how to support women, Alaskan Native women, women of color, in order to ensure that all moms and babies have a chance, a fighting chance.
For families who have experienced the challenges of premature birth firsthand, March for Babies is a chance to share their stories and advocate for better care.
We were not expected to deliver a baby that would be breathing on her own. She was actually supposed to not survive birth. And throughout the journey, like I said, 118 days in 2 different NICUs, in-state and out-of-state. So having to navigate that, still working, we're both full-time workers, and having to navigate that has been an extreme journey. And just her care is different. We always have to be vigilant and remain, always aware of the changes in her body. Although she is the only surviving and thriving, the journey continues.
Participants like Jeffrey, who benefited from the care supported by March of Dimes, find the event deeply personal and meaningful.
I was born at 35 weeks and had to spend a week in the NICU. So I personally benefited from a lot of the science and research for treatments that the March of Dimes has funded over all these decades.
Alpha Phi Alpha is a fraternity, a social organization known as a Greek organization at a college or university for male students.
It is so important that we make the choices around healthy pregnancies and mothers being able to bring and deliver healthy babies. And the work that March of Dimes does is, it's critical to our future. So our fraternity had a history of understanding what it means to be servants of all, to not only understand their role as leaders, but also as partners.
I think it's important that we support in a number of ways. Through our fundraising opportunities, because obviously healthy babies are brought about because mothers are doing the right thing to take care of themselves. We can also look at legislation and be in support of those issues that women are fighting for.
Fundraised during March for Babies each year helps provide services such as mobile health clinic for prenatal care, conduct research, and advocate for policies that promote maternal and child health. Linord, Moudou, VOA News.